Okay, the Ontario Clinical Exam is a two-part exam. We've reviewed in other videos part 1, we're now skipping on to part 2. So in part 2, there's 11 vignette cases that are going to cover professional issues and ethical standards. Let's review those 11 topics. The 11 different cases are based on the following main areas. Number 1, supervision and assigning care to support personnel, like PTAs or rehab assistants. Number 2, expectations regarding fees, billing, and account oversight. Number 3, addressing discrepancies between employer expectations and professional standards. Number 4, conflict resolution or conflicts of interest. Number 5, confidentiality and privacy. Number 6, infection control and prevention. Number 7, professional boundaries. Number 8, ethical issues. Number 9, prioritizing care and time management. Number 10, physical and emotional safety of patients. And number 11, communication strategies. So one thing I can update you on is our students have really enjoyed part 2 of the exam, to be honest. It seems like something that once they know the information, they typically keep it in their head and they do really well in that section, especially on our mocks. I like to think of part 2 kind of more like math. There's one answer, right? 5 plus 5 is always going to equal 10. Once you know what the correct response is in an ethical situation, you're gonna know how to deal with any question that comes up like that. Now, we do have 170 practice questions to ensure you know how to answer every question, but it just is one of those things that put in the work, go through the classroom, and you'll be able to answer any of these questions. All right, as always, I love a good practice question to get the brain going. So let's review a practice vignette to help you understand how to formulate your answer for part 2 of the exam. So this scenario is going to cover infection control and prevention. So we encourage you to take 3 minutes to prep for your answer once we show you the question. You're a physiotherapist working in an acute neurological unit. A new patient has been transferred to the ward post-CVA. The patient was stabilized in the critical care unit without any surgical intervention and has now been transferred to the ward to begin their rehab. Their chart indicates that the patient is hepatitis C positive and requires a 2-person assist to transfer. You and your colleague decide to work together to assess and transfer the patient into a wheelchair. Prior to entering the room, your colleague states that they are concerned about working with someone who has hepatitis C, and they begin to don the following: gown, gloves, mask, and goggles. How would you proceed in this scenario? As a reminder, feel free to pause and take 3 minutes to prepare your response. Okay, let's go over the answer. So a well-rounded response to this question is going to cover 2 areas. So number 1, it's going to cover your understanding of pathology-specific donning and doffing requirements. And number 2, you're going to need to talk about your communication plan to address this conflict with your colleague. All right, the major action required for you to explain in this case is that you're going to treat the patient and not the disease. Hepatitis C does not require PPE unless they have an open wound, and nowhere in this case does it say that. So first of all, you want to explain that your knowledge of hepatitis C would show that you don't need to don or doff any PPE, right? You would then want to talk to your colleague and explain this to them. Actually, what you're wearing is not required to go in to see this patient because they don't have an open wound. And that's really it. That's all you would need to do to explain your knowledge of both PPE and communication. One further thing you could do is you could talk about how your colleague is responding. If the colleague was adamant that they still wanted to wear it, then okay, let them wear it. Go talk to your supervisor and say, they still wanted to wear this. This isn't an inappropriate use of it, and so bringing it to their attention.
If you're finding this helpful, you are going to love the OCE classroom. This is such a great tool to help you prepare for the OCE. Now, in the part 1 classroom, you're going to have cases, a description of all your pathologies, as well as a detailed overview of strategies to prepare for both case 1 assessment and case 2 treatment. In the part 2 classroom, you're going to have everything you need to know to prep for those ethical scenarios. And then last, you're going to bring it all together and check your knowledge during your 3-hour one-on-one mock OCE. We can't wait to see you in the classroom.